In this presentation, we're going to cover some of the standard operating procedures with regard to the safe handling of diagnostic samples in the laboratory. And of course, with the recent emergence of the highly pathogenic H5N1 in Asia, Europe, and Africa, safety has been a much higher concern than it has been in the past with regard to working with samples suspected of having avian influenza. So we're going to review some of the standard operating procedures that will be used this week in lab, and also those that probably should be in place in each of your respective laboratories at home. So what is laboratory safety? Well, basically it's the prevention of physical and or acquired infections in people with zoonotic disease agents. And I guess I would like to emphasize or reassure you that laboratory safety is really everyone's responsibility. Everyone has to participate and do their part in making sure that their coworkers and themselves are protected from accidental exposure, infections, or laboratory accidents. And in this course, although we are not going to be working with any live agents, we will work in the laboratory as though we were working with live agents. So we'll keep that in mind as well. So what is a zoonotic disease? Well, as described by the World Health Organization, a zoonotic disease is an infection that's naturally transmitted between vertebrates and man, with or without an arthropod intermediate vector. And of the approximate 1,700 known pathogens that affect humans, it's estimated that about 49 or 50% of those are zoonotic. So if you're working in the laboratory with certainly human samples, a very high likelihood that the samples coming in as diagnostic samples could be ones that could be transmitted to man. And other information regarding more recent emerging diseases, of 156 pathogens that are considered to be emerging diseases, about 75% of these are considered to be zoonotic. So we do have to be careful in the laboratory when working with diagnostic samples, because we really don't know what might be in those samples. And our concern, at least with regard to what we're doing, is of course associated with the highly pathogenic H5N1. And that has now been confirmed in over 225 people, and of those more than 125 have died following the infection. So there's a very high case fatality rate, which means that we, when working with these potential diagnostic samples in the laboratory, have to take very high-level precaution to make sure that we protect ourselves from exposure and certainly infection. One of the good things, if there is a good thing about the highly pathogenic H5N1, is that all of the infections thus far, or at least most of them, have been through the direct contact with birds. There has been very limited evidence of human-to-human transmission, but of course the fear is that this virus, if given enough opportunity, may adapt to humans and develop the capability of human-to-human spread, which could then lead to the possible emergence of a pandemic. Now, what I'm going to tell you this morning is really not all you need to know about safety in the laboratory. The guidelines for safe work of in the laboratories is really provided in what we call the BMBL. It's the Biosafety in Microbiological and Biomedical Laboratories. And I have provided a website for you to download this particular document. This is the 4th edition. There is a 5th edition that has been completed, and it is due to come out sometime in 2006. And this new edition has a completely revised chapter on safe handling of avian influenza virus. So I would encourage you to access this website and certainly keep track of when that new 5th edition does come out. So, and these are the guidelines that you really should follow. I'm just going to provide you some very general overview of what's in that manual. In this manual, they have divided biosafety levels into 4 categories. The BSL-1, which is the lowest level of biocontainment, are really an environment to handle safely microorganisms that are not known to cause disease in humans, and of course because of that have a very low community risk. Those microorganisms that should be worked in BSL-2 conditions or environments are those that can cause human disease, but again with minimal community risks. And many of the university laboratories would be of the BSL-2 variety. BSL-3 is a much higher level of biocontainment, and these are required to safely handle microorganisms that cause serious disease or at least potentially lethal infections in humans. And of course the highly pathogenic avian lineage of H5N1 would certainly fall under this category. But I might also add at this point that in addition to BSL-3, there are different categories within that level. There is a BSL-3 enhanced, which has a higher level of requirements than just a standard BSL-3. And I would encourage you to make sure that you understand what those enhanced features are that would be required to work with the Asian high-path H5N1 in terms of isolating the virus. Usually, if the laboratory is doing just PCR only, without doing egg inoculation, then BSL-2 laboratory environments are usually acceptable. However, if you're going to do virus isolation with the Asian high-path H5N1, then BSL-3 enhanced safety guidelines should be followed. And the highest level of containment is BSL-4, and this is a very stringent environment designed to safely handle microorganisms that cause life-threatening diseases in humans, such as Nipah virus or Ebola. Be a couple examples. Now, when we work with organisms in the laboratory, we think in terms of how we can contain these organisms so that we don't have exposure of laboratory personnel. And we look at these as containment barriers. And we look as primary, secondary barriers, tertiary barriers, etc. But equipment are considered a method or a means of primary barriers. In other words, we can use biological safety cabinets, or BSCs as we abbreviate them. Class 2 are usually acceptable for use with the highly pathogenic avian influenza virus. I will show you an example of that in just a moment. But also such things as just using centrifuge holders that have covers on them so that they can restrict the creation of aerosols should a vial break in the centrifuge while it's running. And also the cages that are used to house birds could be considered as a primary barrier to contain these infectious agents. Secondary barriers are basically related to the facilities, the room that the primary barriers are located in. These are usually part of the building design, and these buildings should be designed to control traffic so that you don't have personnel that don't need to be in that work area. We restrict their access. Airflow, such as HEPA filtration, is another secondary barrier. We talked about the biological safety cabinets as being the primary barrier. That in itself is the first means of reducing exposure to people, but also the facilities. The HEPA filtration of the air exiting that room or that building can prevent escape of that agent from the building itself. And then of course, in many cases where BSL-3 enhanced is required, the treatment or waste from that building or room must be treated to allow before it goes into any sanitary sewer system. This is a picture of a BSC Class 2 cabinet. The idea of this cabinet is both to protect the worker and to protect the specimen that you're working on and to protect the environment. So we see from this diagram that the air that enters the cabinet comes from the room, and this air moving in the direction to the inside of the cabinet protects the operator from exposure to whatever is being worked on in the cabinet. The air flowing over the samples in the cabinet is filtered through a HEPA filter above the cabinet, which the airflow then moves down and through the grates to a fan below the working surface, which goes up through a plenum in the back of the unit and then again is recirculated. So the amount of air that comes into the cabinet in point A exit the cabinet at point C. So the same volume of air coming in is going out. Now there are cabinets that recirculate the air into the room, and there are cabinets that are hard ducted so that the air leaving that cabinet is exhausted through a series of pipes to the outside. Now some general things that you need to be concerned about in using a biological safety cabinet is what we'll review at this point. The biological safety cabinet will only do as good a job as you allow it to do. You, the operator, have a lot of control over how effective this biological safety cabinet can be in containing the organisms that you're working on. And some of the things that you need to be aware of is that these cabinets need to be certified at least annually to make sure that they are operating properly and that the filters are not broken and allow the movement of infectious material through those filters. So that should be a standard operating procedure in your laboratory. These cabinets should be turned on for a few minutes prior to their use to establish clean air and to establish the airflows within the cabinet. Some cabinets have a movable sash that has to be in the correct position to allow the appropriate level or amount of air to enter the cabinet, and usually they will have a buzzer or a beep to indicate when the sash is in the correct position. And of course, if the cabinet is supplied with a UV light for disinfection or decontamination of the cabinet, these lights must be turned off whenever anyone is working in the room or certainly within the cabinet. Some of the other things you need to do before you start your work in these BSCs is you try to organize the materials in the cabinet so that you're working from a clean side to a dirty side. You shouldn't have clean and dirty activities being randomly placed within the cabinet. So organize your material to segregate the clean items from the contaminated ones. And of course, to prevent the deterioration or corrosion, you should choose disinfectants that will be effective in inactivating the agent you're working on, yet not cause corrosion in the cabinet itself. Only one person should work in the cabinet at one time because, again, you're disrupting that airflow anytime you have a lot of activity going on within that cabinet. The position of the operator should be so that the armpits of the operator is about level with the bottom of the window, and this then assures that the operator is not sitting too low where exposure to any movement of air from inside the cabinet outside by the movement of hands or arms would cause exposure to that person. If the operator is too high, then the position of the arms will not be comfortable and will not be able to reach most areas within that cabinet. And of course, most importantly, it should be a standard practice that you use good aseptic technique. The airflow is very important in maintaining the integrity of the diagnostic sample as well as the user. So you want to use slow movements within the cabinet to prevent the disruption of the airflow in the cabinet. You should never place items or papers or pans that cover the grills to prevent the natural flow of air over the work surface. Now, while working in the cabinet, we should also be aware that these cabinets should be placed in areas where there's not a lot of activity. A person walking behind the cabinet, for example, can cause a draft as they move swiftly behind the cabinet, and this air turbulence could allow then air from inside the cabinet to be pulled outside of the cabinet. And of course, minimize the activity within the cabinet. Try to enter and exit the cabinet from straight lines to cause the least amount of air turbulence or disturbance. And then after you're finished, of course, you have to safely remove any materials that you have within the cabinet, and these should be disinfected before they are removed. And then the inner surfaces of the cabinet should be thoroughly disinfected as well, so that it's clean, so that the next operation can be started within just a few minutes. And if you're going to use a cabinet intermittently throughout the day, it is recommended that you just leave the cabinet running instead of turning it off and on as needed. These filters, these high-efficiency HEPA filters, unless you're working with a lot of dusty or dirty material in these cabinets, will last for several years. So it's not a matter of plugging these up. And actually, the efficiency of the filters do improve a little bit with some accumulation of material on the HEPA filters itself. And of course, they should be kept free of extraneous materials and should not be used as a storage cabinet or piece of equipment. Now, some of the standard laboratory safety practices that should be used in most any diagnostic laboratory, of course, no mouth pipetting should be allowed. Mechanical devices are always used to manipulate samples in the laboratory. Disposable gloves and the washing of hands frequently prevents possible exposure when you move your hands around your face or eyes, etc. But you also should not touch your eyes or your face while working, certainly within the cabinet or within a dirty environment. Anytime you finish an activity, the work surfaces should be decontaminated with appropriate disinfectant, as well as cleaning up any cleaning up any spills or splashes that should occur while manipulating samples, either in or outside of a biological safety cabinet. The access to the working environments always should be restricted if possible. Only those people that need to be in that laboratory environment should be allowed to be there. Obviously, there should be no eating, drinking, or smoking allowed in the laboratory at all, because this minimizes the exposure of materials through contamination of going to the mouth, etc. And of course, proper disposal of waste materials. Now, also in the labs that we'll be doing this week, we will be using some sharps, and we do ask that these sharps be placed only in the biohazard sharps container. We do not want any of these materials in waste baskets that, if picked up by some unsuspecting person to discard, could result in a puncture or injury. So please make sure that the biohazard or the sharps are placed only in the sharps containers. And then, of course, depending on the activities that you're involved with will require the appropriate use of personal protective equipment, and we'll discuss that here briefly. Now, many of you probably have questions about what is acceptable in terms of working with the highly pathogenic H5N1. And these are some of the general guidelines that we have established. We would not say that these are the absolute optimum procedures to protect yourself, but again, refer to the BMBL. But this is some guidelines that we have developed in our laboratory for the use with the highly pathogenic H5N1. We are requiring all people to wear safety glasses, and this is a standard procedure, whether we're working with just routine diagnostic samples or with the high path H5N1. Gloves are required. bodies and arms are required to be covered by a lab coat, and this has to be a long sleeve to protect from exposure of any skin while working with these samples. And then for the nose and mouth, we require an N95 or equivalent respirator. There are many types of respirators available. There are full-face respirators, there are inexpensive N95 respirators, and there are more expensive N95 respirators. But the bottom line is that if you're going to use a respirator, all respirators that are rated N95 or higher require a fit test prior to their use. And this is important, because if you don't have the proper fit of these N95 respirators to your face, it will not protect you. And so you have to make sure that you know how to properly put these on and make sure that they are working as they are designed. The fit testing has to be conducted, as I said, prior to its use. They must be conducted annually. So just because you get fit tested now doesn't mean that you are good forever. And particularly if you've had any changes in weight or the type of respirator, you need to have a refit for that particular style, or in the case if you have extensive weight loss or weight gain, the size and shape of your face may not fit that same respirator in the future. And we've had some experiences where not all respirators will fit all people. So if your face is narrow, you have high cheekbones, these respirators tend to not fit so well. So make sure you have one that works for you. Now, as far as the laboratory dress, for this course we're going to use safety glasses, lab coats. Whenever we're in the lab, we use safety glasses and lab coats. We wear disposable gloves whenever we're doing any manipulations. And if you and when you leave the laboratory environment, you leave your laboratory coats and safety glasses in the room. You don't take them and wear them in the halls outside of the laboratory. And then finally, one thing that probably many of your labs have already started some initiative to attain quality assurance in your laboratory. Quality assurance is basically a very sophisticated program. Most laboratories are using what they call ISO 17025 standards. I have a website here that you can get some additional information on that particular standard. But what the quality assurance program does is that it's the routine monitoring of all the things that go on within the laboratory, so that it increases the confidence of your customers that the procedures are being performed as they should be. In other words, you're monitoring on a regular basis all the pipetting devices. So if the protocol calls for 0.025, then you know that that pipetter is going to deliver 0.025 if that's what you have it set on. And particularly it's important for the very small quantities for PCR, where you have 1 or 2 microliters. If you have a pipette that's not calibrated properly, you will have inconsistencies in the performance of these assays. Then anytime you move a biological safety cabinet, then these have to be rechecked to make sure that they are working as they are designed. And of course, monitoring on a daily basis, incubators, water baths, centrifuges, thermocyclers, to make sure that they are performing up to the standards that are expected. Now, in conclusion to what we've covered in this presentation, we know that there are different biosafety levels, and these biosafety levels are then designed to help determine the extent of protection needed depending on the organisms that you work with. Containment is not just one activity. It's a combination of basic and special practices of safety equipment and facilities to make sure that we have a safe and work environment for everybody in that environment. And then quality assurance programs provide increased confidence in the test results that come out of a laboratory. So if you know that you are monitoring effectively all of the components being used in diagnostic tests on a regular basis, I think you can expect that the quality of the overall quality of the results coming out of that laboratory is probably going to be pretty good. Now, just a quick overview of what we will be doing this week in terms of the laboratory. We've got it broken down into two groups or two types of activities. One will involve the virus detection or antigen or RNA detection, and for that we'll have an overview of virus isolation. We will actually give you 7 unknown samples for which you will try to identify what those unknown samples are, and we will be using HA and HI for that. We'll be using antigen capture as well as AGID, and we'll be using real-time RT-PCR. As far as antibody detection, we'll again give you a series of 10 unknown samples, and you will evaluate those 10 samples using both the AGID tests and ELISA tests, which are type-specific tests. In other words, that will detect antibody to all of the 16 hemagglutinin subtypes of avian influenza. So that's kind of an overview of what's going to be happening this week and how we're going to be working in the laboratory to make sure that we have a safe environment. And I wish you all the best in determining the results of your unknowns.